does someone know if they're a good candidate for a breast lift?
Like any cosmetic surgery, the best candidates for a breast lift are patients that are healthy, that don't have any major medical problems like bleeding or clotting disorders, heart disease or lung disease. But specific to breast lift, the best candidates for a breast lift are those patients who with time or weight loss or pregnancy have had sagging of the breasts with loss of superior pole fullness.
So what happens during the consultation?
Oh, the consultation is very easy, and most people find it makes them a lot more comfortable with the procedure in general. But when they first come in, they'll meet the front desk staff and fill out the paperwork. The front staff will show them a lot of pictures that aren't on our internet, and a full range of pictures, not just the best that we highlight, but our average results, some of the ones we weren't as pleased with, and some of our good results. And then we try to pick photos that look similar to how the patient does, and then show the patient pictures of how they might want to look. And then after the patient sees pictures, then I'll talk with the patient, get to know them, what their goals are, and then finally the patient will bring into one of the rooms, and I'll take breast measurements, do a complete history and physical, examine the breast, take the breast measurements, and we'll discuss what their needs are and what their anatomy will allow.
Are there different techniques?
Yeah, of course. There's many different techniques. We can first start with the scar because that's what most patients are most concerned about. So a breast lift can be performed through an incision around the areola, which is the colored skin around the nipple, or it can be performed through an incision around the areola with a vertical scar that extends from the bottom of the areola to the breast fold. Or there can be an anchor scar, which is again a scar around the areola, vertically down the breast, and then a horizontal scar in the breast fold. Typically though, for most of my patients, and most patients in general, a breast lift can be performed through an incision either around the areola or vertically down the breast. Seldom do we have to use an incision horizontally in the breast crease.
So would it change the size of someone's areola?
Of course. Again, with aging and pregnancy, a lot of women get widening or stretching of the areola, which they find unattractive. So whenever we do a lift, we make an incision around the areola, again, the colored portion of the nipple, and make that the ideal aesthetic size, which happens to be about 38 to 42 millimeters. So with the lift, you do get a reduction in the areolar size.
So what kind of pain is involved?
Most patients don't complain about pain. I see all my patients the day after surgery to see how they're doing, make sure they're doing well physically, mentally, emotionally. And then if they have drains will usually come out the first couple days. And then pain-wise, most patients may take narcotics for the first couple days, particularly at night, to help them sleep. But usually by day 2 or 3, they're off the narcotic pain meds, just taking something over the counter, and return to work, say, 2 or 3 dabe later.
How long do the typical results last?
Well, I didn't talk about this earlier, but a breast lift can be performed by itself for a woman who is happy with the size of her breast, but just wants the nipple and the shape of the breast to be a little more youthful. Or for a woman who wants those characteristics, plus they want to be a little bigger, the breast lift may be formed with an implant or an augmentation at the same time. So, as you can imagine, a breast lift can't be permanent because the breast tissues continue to age as we age. An implant doesn't age because it's a prosthetic. So if you have a breast lift with an augmentation and a prosthetic implant, you may find that the results seem to last a little longer, but in general, no, the results aren't permanent because the breast will continue to age as we age. But most people are very pleased with the results for at least 5, 6, 7 years.